everyone, and welcome to Emotional Grit, the podcast where you can learn about the power of perspective and the science that fuels us. I'm your host, Jennifer Fernjack, and I'm incredibly grateful to say that my guest today is Carin Andersen. She not only has survived an aortic dissection, I can't even pronounce it, and she survived it, but she has since gone on to co-found a nonprofit called Aortic Hope that literally has benefits to people around the world. So for more information about this podcast and to watch it and other episodes as well, please feel free to go to my YouTube channel that's called Emotional Grit as well, and like and subscribe. So Carin, without further ado, I'm so happy to have you here today.
So exciting to be here because I'm usually not on this end of the table. I'm usually in your hot seat. So this is interesting and fun.
Yeah, great. So if you wouldn't mind just starting out for our listeners and explaining what is an aortic dissection and what happened when you had yours.
Wow. So if you ask people what is an aorta, so many people don't even know what that is. And that's not shameful because I had no clue what it was either when my event happened to me. So your aorta is basically your lifeline of your entire body. It is the largest vessel that comes out of your heart, comes right out of the top of the heart and then goes over like a candy cane and hooks behind the heart and goes straight down. There are vessels that come off of the aorta that go towards the head, like your carotid arteries. Some of these arteries people have heard of. It also feeds your kidneys, which would be your renal arteries. It feeds into your legs. You've got femoral, you've got iliacs. It goes all the way down into the belly. So everything that's in your body gets fed oxygenated, rich blood that comes from the lungs and the oxygen, and it pumps this blood and gets it right into your entire body system. So it's very important. And the different things that can happen to an aorta, the two most common that we talk about, first would be an aneurysm. And so an aneurysm can happen in any vessel in your entire body. We often hear about brain aneurysms. We do hear about those a lot, but we don't really hear that many people talking about an aortic aneurysm. And what's interesting is a dissection is very rare, but the aneurysms and aortic disease in general is much more common than you think. So if the best analogy would be if you think about a garden hose, and you've had your garden hose now for 15 years, 20 years, 25 years, and you turn on that water and it's coming out full blast all the times you use it. Eventually, we've all seen a garden hose that gets a little hole and the water spouts out. Well, before that happens, it has to have a weakened area. So an aneurysm is an area that becomes weak and can tend to balloon out. And that's precarious because if it's anywhere near coming out of the heart and traveling up, that's ascending. That holds the largest amount of blood volume because, again, it's coming right out of the heart. And if it has an aneurysm that is anywhere after the arch, that would be thoracic descending. And any aneurysm in the belly would be an abdominal aneurysm. So in my particular case, I didn't know that I had an aneurysm or a dilated, enlarged area. The medical community knew, and they didn't tell me, and we'll get into that with the story in a minute. But what happens with a dissection, which is different than a rupture, is that you have three layers of your aorta. You have the outer layer, which is called the intima. You have the middle, which is the media, and you have the inner, which is the adventitia. Oh, that word stumped me not too long ago. So they each do different things. One is a little bit more, I guess, not fibrous, but stronger. They each hold different things, but wet. It's like touching wet tissue paper. It's incredible. Just how easy they are to manipulate, but they are collectively very strong. Well, what happens with a dissection is what the inner layer will actually dissect or tear away from the other layer, creating a false chamber where blood flows into that. That's called a false lumen. Where
Okay.
your blood flows and perfuses to all of the organs, that's called a true lumen. So when it dissects and pulls away, the problem is it usually lessens the amount of space that your body can receive the blood flow from. So this false area is filling up with blood and it's not going anywhere. So there's a lot of complications that can come from this until it clots off and creates a thrombosis. Now, if you have a dissection in the area coming out of the heart, going upwards or ascending, that's a type A. Very, very critical. Must really seek emergency medical attention. And typically you're going to have open heart surgery to receive a Dacron graft that's going to reinforce everything. Now, if that dissection occurs after the arch, And anywhere headed down, that's called a type B, or as one of our doctors in the community call it, a bascending, descending to bascending type B dissection. And as you get closer to the abdominal area, it's not necessarily as fatal because you're not having the same blood flow, but these things need to be addressed. Typically, a type B is medically managed, making sure your blood pressure and your heart rate are in good numbers, in a good range. And sometimes people in the lower area need to receive a stent, which can happen endovascularly. They go in, usually through the groin, and they can deploy a stent which reinforces that area inside the aorta.
Okay.
So, of course, if I'm going to do something, I go big and I do the whole thing dissected. So, that's a little bit of an explanation about a dissection.
Wow. So what exactly happened? Where were you? And were you with anybody when this happened to you, when the actual dissection took place?
So it's been so long since I've actually told my story. So let's go. This is going to be fun because usually after almost 9 years, your story gets shorter and shorter and shorter because, and you've told your story. I've heard your story, and to a fresh set of ears and eyes, it's brand new. So
Right.
let's think about this. Okay. Understanding my prior world before the aortic dissection, I had lived with Crohn's disease for the majority of my life, for 20 years of my life, to the point that working and functioning, albeit difficult, was just, having Crohn's disease, you just did it. You
And
had an
Crohn's,
emergency bag of clothes. I'm sorry.
oh, Crohn's disease is an abdominal condition, correct?
It is found in usually the small intestine, whereas colitis is typically found in the large intestine or the
Okay.
colon. Correct.
Okay.
So mine really affected near the ileum. So that's where the two areas join and come together. So that was my typical area where my Crohn's settled. And what Crohn's disease is it's a disease that is genetically passed most times, more times than not. And it's basically the lining of the intestine thinks that there's always an infection. So it's always inflamed, and it sometimes can ulcerate. And so the inflammation makes it very challenging for food to pass through because you're talking about an area that's like the size of a spaghetti noodle, and food just sometimes you get blockages, etc. So I battled that for many years. My mother and most of the relatives on her side of the family had Crohn's. So this was something that Johns Hopkins wrote about my family many, many years ago, about how many people in the family actually had this. But to me, Crohn's disease was really a no big deal until 2012. I had my third bowel resection. And then about 2 days afterwards, I was feeling really, really sick. And I told the physician I wasn't doing well. And he said, "Your Crohn's came back." I said, "That's impossible. You just cut it out. It doesn't come back in 48 hours." He said, "Well, it did." Very dismissive. I had to wait 6 weeks and I had a colonoscopy, and they found I had a hole in the anastomosis, or where they attached the intestines back together, and it had abscess. So I had to have I had to be cut back open again and have another 6 inches of intestine taken out. Then I
Wow.
felt better. So, that's like one of my first experiences where I felt really dismissed, and I really became very, very depressed after that. I was left without a belly button. And I know it sounds silly to say now, but a belly button connects you to your parent, your mother.
Yeah,
And
yeah.
it's like
I
I
get
look
that.
down and I have nothing. So I was a little depressed, but I was definitely feeling better. And I decided to join a support group and really struggled with accepting the fact that this was now accepted under the ADA. So now I officially have a disability, and yet I'm functioning with it. It was very hard in my mind. Fast forward to the fall of 2014. I had just come back from a trip in Aspen where I really struggled breathing, just assuming that it was altitude sickness, never thought anything else.
That's what I would have thought. Yeah.
Exactly, right. And then I participated in a 10K for the Crohn's and Colitis Foundation of America, where I walked very fast in a tutu, but I did make it in under 2 hours. So I was kind of into it and looking at time. I didn't understand, but I was like, at least I made it across Vegas, all the way up and down the strip. I was very proud of myself. Up until that point, I was a ballroom dancer with no formal training, but winning, competing, very, very active.
Wow.
So 2 months later, January comes around. January 29th, it's a Thursday. I just had lunch with our vice president of the organization, who I knew personally, and I came home from work and I plopped on the sofa with my dog to watch the Ellen DeGeneres show. And my
Okay.
son was upstairs, 15 years old. Husband's at work. And I'm going to watch the show because I love Ellen and I'm so excited. And I feel this little pop, like a bubble popped on the right side of my neck. But it hurt enough that I grabbed it. And I thought, this is really strange. Maybe I have to burp. I
Yeah,
don't
yeah.
know. So I sat up, made a little burp, and then I went to lay back down and it really, really was aching terribly. And then I felt a little bit of indigestion. So I sat up again, let out a burp. And I thought, ooh, chicken teriyaki from lunch, just really coming back to get me. Because I don't know what else to think. Then I had to go to the bathroom. And this is the honest truth. As soon as I sat down, I could not feel my arms or legs. And I know that a lot of people say that, and really it's like pins and needles, or like, because maybe you were sitting weird. My arms and my legs went numb like I had been given a nerve block. And it was the most freaky, scariest thing I had ever felt. And I said that the gas escaped one of my surgical sites and is now on my spine. This is so bizarre. The sensation came back. I got up, I called 911 and I said, I can't believe I'm bothering you, that I have really bad gas, but I have Crohn's. I ate this chicken teriyaki sandwich and the gas left my intestines and it's now on my spine. And I can try not to laugh because when I
And you're
first
like,
told that
and
story,
I have no belly button. So
I
you're
have
like,
and I have no belly button on top of it. But what else would it have been? I mean, of course my gas is on my spine and I couldn't feel my arms and legs. And she says, I need you to eat some baby aspirin. I said, you mean like Bayer? Because I don't have the baby. She goes, no, the adult, like eat the 81 milligram. She goes, and stay on the phone with me. So I eat it. And it's like you start foaming at the mouth. It's so disgusting. And I'm like, this is really gross. So I don't know why I'm doing it. I mean, I was completely with it. So the ambulance comes, my son handles the dog. I said, "You put her away and then come up front and sit in the front of the ambulance." Just then my husband came home. I said, listen, don't call my parents. This is probably some freaky Crohn's thing. And we're just going up the street to the medical center. We came in. I told the doctors in my medical history, this part's important, because I had been in so many times with Crohn's, they knew that my father had an abdominal aneurysm. They knew that I had not dissected, I had detached my retinas. So did my paternal grandmother. So these things are in my record from, prior conversations. So he listens to my chest and I feel and he hears a flutter. Okay, not necessarily earth shattering. EKG was perfectly normal. My blood pressure was maybe 140 over 85, relatively normal for people that have really high blood pressure. And they said, you know what? Let's take your pulse. I mean, your pulse. And they checked everything, my blood pressure, I'm sorry, on both my arms. There was a significant difference. I was not told at the time. And that was enough for him to say, we're going to order a CT scan. Well, I'm used to having a million CT scans because of Crohn's disease. And for me, I have to be pre-medicated because I'm very allergic to the dye. So I get prednisone and I get Benadryl. And your body's like, should I sleep or run a marathon and do both at the same time? Needless to say, I became violently ill, violently ill. I mean, I am not a person who vomits, and especially not in front of my husband. And we had only been married 2 years at that point. I wasn't, it's done none of this hold your hair. I'm embarrassed, I'm like, oh no, I still have to be dainty and pretty. So I start puking like terribly. And I knew something was very wrong. And I can remember that my thought process was just starting to become a little off. So I knew some things were changing, but I didn't know how to verbalize.
yeah, yeah.
Okay. So I have this CT scan and I come back and the doctor comes in and he looks at us and he says, you have 2 minutes to decide where we're going to life flight you because you're having an aortic dissection. And I said to him, do you mean like the actor John Ritter? Now I knew that, pulled that memory out of my brain from somewhere, but I had also just seen an episode of Dr. Oz who was live. They filmed it. He was on an ER show and a patient of his was having a dissection. So I said, do you mean like John Ritter? Am I going to die? And he looks down. So he leaves. I said to my husband, I am not calling my mother to tell her I'm about to die because I'm going to get punished. So you have to make that phone call. I mean, this is the weirdness of the mind. Like
Yeah.
it's not settling in with the fact that I'm going to die. I'm more concerned that I'm somehow going to get punished from my parents. So um, he called my parents. He called another friend who had a connection. My mom's on the phone with a cardiologist. Everybody's working out their deal. And they decide on University of Maryland has a shock trauma unit. It's been featured on TV before for their brain institute, for their brain surgery.
Okay.
So the next thing I can really remember is my parents had to go put gas in the car and pick up my son because he was now home. And they're Googling, my mother's Googling as they're driving. And it is just, you do not want to Google aortic dissection because it is highly, highly fatal. So I can barely remember signing my name to the form because they were going to flight me out, but then it was icy. So I had to be ground transported. My husband says when he got to the hospital, he was hoping they were going to take a look at a scan, like there was going to be a doctor and say, I don't know what they're talking about. But when he got there, there were about 15 doctors that were there
Oh.
that said I had about 5 minutes to say goodbye. But let me tell you about the trip in the ambulance. Again, just the power of the mind and how it goes into self-preservation mode.
Oh, yeah.
So I'm in the ambulance using somebody's phone because I don't know where mine is at this point, and I call my ex-husband and I tell him that I'm going to die. I'm very calm. And I said to him, we have different political beliefs. Please raise our child to be an independent thinker and to be respectful of women. He will move in with my parents. You will see him whenever you want. And then he's going to go to college. There'll be an insurance policy. Well, he collapses to his floor and I'm saying, hello, are you still there? Because he
Wow.
doesn't understand. So we hang up. And then I call my sister, who is still semi drunk, but has sobered up now. She's at a holiday party. And I say to her, listen, there's a list of passwords underneath some table I mentioned in my bedroom. And there's a bag. You've got to get it because if mom and dad see what's in this bag, I'm going to die. I'm just going to be so embarrassed. I mean, nothing I said lined up with the fact that I could probably die. It was all save my soul from my parents is what I was looking to do.
Right.
And she's like, you're going to be fine. And then I supposedly was cursing at her, shut the mom up and everything. And then I called a friend of mine who's an interventional radiologist and asked him if I would be okay. And he lied. And he said, you're going to be fine. You're going to the greatest people in the world. He worked for this hospital, but he, of course, had to lie and tell me, oh, it's routine. He hung up and told my best friend at the time, this is not good. You have to prepare yourself for the worst. And then I called my massage therapist and canceled. I called my boss, told her I wouldn't be in on Monday, that I'll probably see her Tuesday. Okay, these I don't even know that I made those calls. They all told me I called them. So I get to the hospital. The room legitimately is full of windows. I remembered it as a closet with 4 walls and a door. So I have no clue what I'm imagining. They came in, they said, you have 5 minutes to say goodbye to your family. We've got to get going. Okay, so there must have been a part of me that knew that that it was serious because my father kept rubbing my feet and he had had triple bypass surgery when I was like in my 20s, which is why I started seeing a cardiologist early because I didn't want anything to happen to me. And when I had my son, I had preeclampsia, which causes extremely high blood pressure, and it's supposed to go away when you give birth, and it didn't. So I was on blood pressure medication my entire life, but not good patient, didn't take it. I knew to take birth control on time, but I didn't know to take that pill on time. So my father's rubbing my feet. I'm like, Dad, am I going to know that I'm on a breathing machine? He said, you won't know. I said, okay. My mom's too busy kissing. She's just kissing. She's kissing everywhere on my face, kissing me. It's just lots of kisses. That's what I remember from her. Then my son comes in. So now I have to look at my 15-year-old, which is, from my perspective, like a movie. And I'm telling him that he's going to be fine, that there's a ton of movies and he will remember me. He will remember oh my God, I'm going to get emotional. He will remember my voice. He will remember what I look like, and that to stay being respectful to girls, that, he'll get married one day. I just, gave him the speech that you have to give somebody when you've got, like, now I'm down to 3 minutes. And I distinctly remember saying to him, I think this went really well, don't you? A line from Terms of Endearment, because I thought I was in the movie. This is telling you the mind, it just does, because I was having a loss of blood internally at this point. I'm like, I think this went really well, do you? Meanwhile, I heard he was hysterical. I have no memory of that. My brain has blocked that out completely. I I really barely remember him standing there. I don't see people's faces when I go back and try to remember this. I don't even remember saying goodbye to my husband. That's another weird thing right there. I must have. I'm sure that I did, or I feel terrible if I didn't. Um, and then the doctors came in and they did something because I looked at them and I said, "Are we in surgery? Did you put me to sleep?" And she said, "No, I gave you a little Versed to calm you down, but we're going to go in a minute." And I don't remember, but I do remember waking up and I do remember being on the breathing tube because I thought I was Aquaman. I'm telling you, I'm weird. I don't know. And I thought, look, I can breathe, but I don't have to breathe. And I'm still breathing. And I tested this out for a while as I was starting to wake up. And then I heard somebody say cough and they pulled it out. And while I was on the breathing tube, I asked for a pencil and wrote down to my father, "Am I breathing?" And he said yes. And then I remember my dad yelling at me, "Breathe, stop, stop holding your breath, breathe," because I still had so much anesthesia in me. And after that, the rest of it is kind of piecemeal together. But,
Wow.
um, and it was
You know,
5 hour surgery and it
isn't it
was simple.
isn't it isn't it interesting how when the brain can't comprehend like the emotion and the logic and whatever all at the same time, it kind of can short circuit. Like I know literally when I had got my news over the phone that I had a brain tumor, which
Yeah.
I never expected, I went into logic mode right away. I was like, I had a pad of paper and a pen. I asked lots of questions of the physician and what should I do and like all that kind of stuff.
Hmm.
But then the emotion hit me after the fact. So
Yeah.
it's interesting how there could be that kind of that dichotomy. And then as you were mentioning, just trying to like to say goodbye to people. When I
Hmm.
was in the waiting area with my parents and my dad's wife before having my craniotomy, because I was cut
Hmm.
open from here to here for my brain tumor surgery, I remember one of the nurses or someone called me to go through these swinging doors. And I thought I was going to see my family again. So I never said anything to them. Well, little did I know that I wasn't going to see them again. And in the hospital, when I was drugged up for 8 days after the surgery, I remember I would dream about it. And I would think to myself, okay, like, well, what if I knew at that moment that it was going to be the time to say goodbye? Because I had been warned going into surgery that I might not come out. So I knew
Hmm.
that, ahead of time. And then just cognitively, it's just kind of hard to get your head around that, as far as like, well, am I going to die today? I mean, it's just a weird.
Right.
And I remember thinking that in my dream, I was walking down the hallway with the nurse and the physician's assistants and stuff to head to the surgical or the surgery room, operating room. And my family is still behind me in the hallway. And I remember I turned around and I said something like, "I'm not trying to borrow trouble, but if I don't make it out of surgery, thank you for everything. Like, thank you
Hmm.
for everything you've done." And then when I would think that, then I would wake up, because it was a dream, obviously.
Right.
But it's like you don't know until you're in that moment how you'd
Yeah.
react. Or to your point, you're losing lots of blood, so you're
Yeah.
cognitively going to be in a different place anyway. And it gives you an enhanced sense of appreciation for relationships. And like
Oh,
when you
yeah.
talk about your mom kissing your face and just kind of like wanting to show affection and what have you,
Yeah.
that of course was meant to benefit you, but it was also to help her because she wanted to
Exactly.
express that emotion and didn't really know how. And it's just
Hmm.
interesting how the mind works, and the fact that with these scenarios it isn't just the physicality of a medical condition, it's also the mental aspects, it's the emotion. And so I
Yeah.
can see definitely why those played a role in your story as well.
It's,
So
because at
amazing.
one point I remember thinking I wasn't scared to die because, well, I can't control that, but I was angry because there was a lot of things I still wanted to see happen,
Yeah,
and
yeah,
I was angry that I knew a lot of people were going to be really upset.
yeah,
And I don't say that with vain. I just say I'm obviously
uh,
my parents would have been devastated by that.
yeah.
So it is weird because I did read in my medical records it said was having cognitive decline. So I knew
Oh,
that these things were happening after I mean, I knew it during and then I read it, after the fact. So, and the crazy thing is everybody's experience with this is different. I mean, we've had people in the community that woke up, lost half of their feet, lost part of their stomach. They just
oh,
had malperfusion. They weren't receiving blood flow because of this dissection. And so you can lose limbs, you can have a stroke, you can become paralyzed,
oh,
vocal cord paralyzation. And I woke up relatively unscathed. I
wow.
don't know.
How long
Yeah.
was your surgery?
What they said was going to be between 6 and 8 hours. So my mom leaves at the 5 hour mark to get coffee as the doctor's coming around the other corner. It was only 5 hours, between five and a half. And I had
Wow.
only initially dissected on that ascending part we talked about coming out of the heart. And while I was under, I started tearing all the way down into my left leg. So I'm so thankful I didn't have to feel that, because I think psychologically that would have been really disturbing for me. And because I
Yeah.
don't really recall being in a lot of pain when this happened,
Wow.
which is kind of nice. But
Oh yeah.
yeah,
How long were you in the hospital recovering from surgery?
6 days. I didn't even go to step down unit. They sent me home from the SICU. They didn't even know how to discharge somebody. That's something I will definitely disagree with. I think that everybody should go to a step down unit. I think we need a little bit of extra time because you don't have that one-on-one care in a step down as you do in an ICU unit. It's two patients
Right.
per nurse.
Right.
So to step you down really gives you that chance to get a taste of what it's going to be like now when you go home. Because when I came home, I recovered 1 week at my parents', and then by the next week I was at my own home, and I sat by myself from 9 a.m. until my husband came home at lunch to quickly make me a peanut butter and jelly sandwich, and then he was gone, and I had to wait until my son came home from school. So there was a lot
So
of hours of
so
sitting.
during the day then, was it just you, your dog, and Ellen?
Just me and my dog. I didn't even watch Ellen. I never watched Ella again from that day. I never watched her show.
Wow.
Well, she's off the air now. I couldn't do
Yeah.
it. I
Wow.
wanted to, and I knew that that was cognitively irrational, but I couldn't bring
Yeah.
myself. I've always thought if I could meet her, then I could do it,
Yeah.
but
Yeah.
never watched her again. No.
So what was the time span between you starting the healing process from surgery and then you thinking, I think I want to create some kind of a nonprofit and share with others the things that I've learned and learn from them as well. And what was kind of the
Gosh,
impetus of that?
so crazy. So first year, had my surgery in January. I realized by May I'm never going back to work because of missing 6 feet of intestine. I don't have the portion that absorbs medications. So I can take pills one day and my blood pressure really soaks them in and it runs low. And so I'm tired. I can take them and it doesn't soak them all in. And so I'm running at 140. So then I don't want to do a lot because now I'm panicking. So I do always wear a patch that'll give me a low level, consistent flow.
Okay.
I knew I couldn't work anymore, and I was about to leave my second most favorite job I'd ever had in my life. I was on the track to becoming the manager. That would have been the very next step, and all went away. Just shoo.
Wow.
I remember going back for my retirement party at 40 some years old, and I couldn't even remember half of their names. Like my
Wow.
brain was so shot. That was the first sign that something's really wrong. And there were some other things like some nightmares, and I was smelling things in appropriate times of the day, lots of alcohol. I would taste alcohol, so weird. So I knew I had a PTSD element, which if you want, we can talk about later. But
Yeah.
so for the first year, I can't figure out what I'm going to do. Do I want to be I could be a substitute school teacher. Nope. Too many germs. I don't want to be
Yeah.
around all the germy kids. Do I want to volunteer in a hospital? Nope, because it's too many germs. But I knew I couldn't hold a job where I would have to be held accountable because I never knew when it hits me so bad, I have to just go to sleep. I have left
Mhm.
functions to this day, and I'm like, I have to be sleeping now. And I leave and
Wow.
I go home and go to bed. Um, so the first year was just living many, many months taking a transport chair because I had no confidence I could walk. I mean, there's so many after effects in my mind of this. So around 2016, there was a gentleman in the community named Timo who comes from Sweden. He had decided with a couple other key players here in the States that they were going to create Aortic Dissection Awareness Day on September 19th. And all I had known at this point was Facebook pages. And, a Facebook page, I might as well be looking at Dr. Google, and it's not a good thing. Because what I'm finding and what I'm hearing is that I've probably got 5, maybe 10 years at best to live. And so we'll talk about that in a minute. Horrible things I'm reading. So they're going to have this awareness day. I start talking about wanting to have an awareness day at the hospital. And then this woman from Pennsylvania, from Pittsburgh, is like, I'd love to come down and do this awareness day. So we start talking, we become friendly. And I find out from her that she did not have a dissection, but she had something called a bicuspid valve. So
Okay.
your aortic valves typically has 3 cusps or leaflets. It can have 2, which is bicuspid. It can have 1 unicuspid. It can have 4. But anything other than 3 throws everything off. So especially when you are bicuspid with two, it can leak. It can become hard, and which is stenosis. Typically, it leaks or it backflows blood into the heart. That's regurgitation. All these things are not great over time. So a lot of those patients develop aneurysms. They found at 25 years old a 7 centimeter, which, to give you a frame of reference, is the diameter of like a Coke can in her
Okay.
chest.
Okay.
She was like 100 pounds wet, tiny girl,
Wow.
active girl. So she had scheduled surgery, had her aneurysm removed, and was doing great. Well, then I heard from another woman that didn't live very far from me. I'm in Maryland. She was in Virginia. She was the caregiver at the time to her husband at the time, who was patient X, first person in his family to find out he had Marfan syndrome. And they had 3 children, and the eldest got Marfan. The other 2 did not get the gene. So the 3 women, we came together, hence initially the 3 hearts. That was the representation. And we were like, you know what? I want more uplifting quotes. I hate reading the things I see. Let's create a group, like a little club, and I think we were going to call it Heartful Hopes or Hopeful Hearts, or I don't know, something like that. We're just going to put inspirational quotes. And then we met up on this day, Aortic Dissection Awareness Day, and I found the live button on Facebook. And meanwhile, this is what you see. I'm pushing it. Does anybody see me? I don't see anybody. How do you know if someone's looking at you? That's how the whole thing was spent, because I didn't even know how to use the button. And then I
I wouldn't know
realized
either.
I have no clue. And I was like, oh, people see me. Everybody look into the camera. So technically our first live event happened. So after that, we started doing some crowdfunding and raising money to be able to give away shirts and just to do fun things. And what happened is somebody in the community was going to have surgery. So I had taken up loom knitting because I was bored. I had no job. And I knitted her a little heart pillow, and she loved it and told people. And then they wanted it and they loved it. So our first initiative as a Facebook page was born, called Hope Mail. And people can sign up. And with the money we raised, we sent them an item or two during their aortiversary month to say, hey, we're here, we're your cheerleaders.
That's a
It was
great idea.
it was like 30 people. We have over 300 people now that basically participate in that.
Wow.
So it was right around 2000. We'd always talked about wanting to become a nonprofit, but around 2018, the John Ritter Foundation was hosting their symposium, this one symposium they had, and it happened to be in Washington, D.C., and we were asked if we wanted to speak. So we got our butts in gear, got the money, found the board, worked day and night to create a website, which, you know, now I see if you have somebody help you, how much easier it can be.
Oh
But I
yeah.
think our original website was pretty good. It was just so much unnecessary work. We created the website, basically had this established name for ourselves because we took the time to research, and came into that event as a nonprofit organization already with global followers. We had a private forum on Facebook. We then opened up a caregiver forum. And a couple years later, we opened one up for those that have lost people. And I will tell you, as I mentioned this to you before, when we became a nonprofit, the goal was to have other people not feel as lost as we did. And, if somebody had come into to my room, whether it was in the clinic after my heart surgery or in the hospital, and had said, hey, I had a dissection too, the fact that they were even standing upright would have given me so much hope. Oh, I'm going to be able to stand up. Oh, this is really possible. If they were talking like I'm talking to you now, I think, wow, they can actually hold a whole sentence without gasping for breath. Oh, they sneezed and they didn't explode. This is amazing. It's going to be me. It's all the same funny thoughts, like if I sneeze, I'm going to probably die. If I have to go to the bathroom, I might die. It's if I laugh too hard or cry too hard, I'm going to explode. Because when this happens to you, you don't understand what's actually happened.
You wonder if it's just you.
Yeah.
You're not gonna
Right.
know,
Well, you know that it's not if you're on Facebook, because you hear
Yes.
all the strange things, but you
Yes.
don't hear the answers. Can I
Yes.
walk to the mailbox? I don't know. Doctor says do whatever you want. I'll see you in 6 months. What does that mean? Do whatever I want. I don't even know what to do. I felt like a ghost, and I described that many times to therapists. I lived outside of my body with everybody staring at me like, "Oh, I can't believe she's alive. Do I hug her? Do I touch her? Do I kiss her?" So it's just
Yeah.
it was very awkward.
When
But the
you mentioned that
majority,
you had,
yeah,
I'm sorry, I didn't mean to interrupt
no,
you.
please go ahead.
When you mentioned that you had PTSD, was
Mhm.
there like a pivotal moment that triggered that, or was it more kind of a slow accumulation of things that over time just gave you that sense of being overwhelmed?
Yeah, it was an accumulation. I think it started off when I kept having dreams about tsunamis and about drowning. I was like, this is not pleasant. So then I started staying up, and now I'm having, insomnia. And again, then I would walk into a room and be like, did somebody just spray Windex, or who has a cut? Like, who's got alcohol? And they would look at me and they'd say, "Well, there's nothing." I'm like, no, I smell something. And that would usually happen because maybe I stubbed my toe or something minor hurt, and my brain would go to this place we would take it from 0 to 100.
That's
So,
interesting about the sense of
yeah,
smell. I wouldn't have equated that with what you're talking about. Is it some kind of a traumatic brain injury, or is it something that's just with the senses were affected by some kind of
miss,
treatment or
it's all part of the PTS. I don't smell it anymore. I had to go through therapy for that. The worst moment
interesting?
to me was driving in a car and having an ambulance that came up behind me and hit their horn, and I hit the deck. So after I hit down, park under the wheel. So after that, every time, didn't matter where I saw the lights and sirens, I'm the only car that puts it in park and would hide and just be
Oh,
like fingers in my ears, rocking. Like if I saw an helicopter, because they land at the local hospital, and if I was downtown Baltimore seeing the Billy Joel concert and I see the shock trauma hospital, I was creating an OCD ritual of needing to stare at it. And I would say, don't talk to me right now. I'd follow it. And then when I saw it landed, I'd say, okay, what were you saying? I knew I was doing these rituals.
wow.
I'm like,
That's
I need help.
interesting.
I need
Right.
serious help.
Right.
Yeah. So
What would you
I got
say it
help.
was that helped you address the PTSD?
So, I had a therapist I'd had for many years, and I was blessed that she came to my house those first few weeks of recovery. I mean, so kind. She would come and have our therapy session there. And what happened was, it's interesting. There is a terminology in the community called pump head. And pump head is thought to be a condition of short-term memory loss or other cognitive weird things, mixing up of words, inability to come up with a word. Because when you have this dissection, it can blow a lot of microscopic air bubbles. It's just a
Mm.
mess that's coming everywhere. Or the heart lung bypass machine innately is going to have little teeny oxygen bubbles because it lives, even if it's in a sealed sterile container, it's going to have air bubbles in it, that those bubbles will get to the brain and cause an issue. However, after having some cognitive tests done and finding out I was passing with flying colors, even though I thought I had no short term memory, he said, I think this is all PTS related, and I suggest you
Wow.
have EMDR therapy, eye movement desensitization and reprocessing, and see if that doesn't work. Well, I'd heard about it in the community, and in my
I've never
mind, it
heard of
was,
that before.
yeah, oh, you're going to love this. It was like, to me, it was like something Mr. Miyagi was going to do, put it on my head. So no, what it is, long story short, think about at the end of your day, everything you see, you taste, you smell, everything gets downloaded when you go to sleep in your REM stage. So your eyes are going back and forth. Now, I'm not a doctor. I'm not a psychiatrist. I'm just telling you what was told to me. So I
Yeah,
hope I
yeah.
get it right. So what happens in the download process when you have PTS is it downloads a couple things incorrectly. It assigns them to a folder that's cognitively irrational, attached with scent issues, sensation issues, hearing, auditory issues, all these different things. So even though I'd had 4 or 5 bowel resections, I'd have probably about 11 surgeries up to that point. I never had PTS, so I thought, from any of them. This one, lack of control, too much vulnerability, the brain shuts down so that your body can just be taken into surgery and have a chance to heal. When it decided to turn back on, it had all these weird things going on in it. So eye movement desensitization and reprocessing typically happens when somebody's holding paddles. It can also happen with a therapist using their finger. This is not hypnosis. But if I walked over to you and I said, Jennifer, shut your eyes, and I stood behind you and I tapped your shoulders like this, your eyes will go left to right because you don't know when I'm about to tap or which one I'm tapping. So when
Right.
I tap, your eyes move. So it mimics that REM stage, that downloading stage, but you're awake and in a safe place. So your therapist will
Interesting.
talk to you about your story. You're holding the paddles and then says, okay, just think about it. Think about whatever part you want. And we close our eyes. And I hold the paddles and my eyes start moving left and right because I feel them vibrate. And every now and then I'd open one eye to be like, "Are you looking at me?" And it was
Right,
a
right.
little difficult to get into. And at first I stopped going because I was like, "Oh, I'm getting headaches. I don't like thinking about this." And then I finally put in the effort. But this is scientifically uh, backed therapy that's typically paid for by insurance. And so after about 6 weeks of processing, thinking about this in great detail, and realizing when I'm done, which you end with an affirmation, you end thinking about your happy place, my eyes open and I know I'm sitting in somebody's office with a bird feeder outside. I am not in a hospital. I'm not trapped. I'm not anything. Actually, at one point in time doing this, she cracked open a alcohol pad. She opened it up, and at first time she did it, I was freaked out because I'm like, I'm smelling alcohol. She goes, "It's just me. Just keep doing what you're doing." It was a way of desensitizing me
Yeah.
to the alcohol while I'm going through this. It was so brilliant. And
Exposure to
now,
it.
yeah, exposure
Mhm.
therapy. And now, because it's done a lot with war veterans, I can hear the ambulance. And if for whatever reason, if I don't feel good, I have a cold or something hurts, I know it's tied into health. I will just immediately look at my Prince symbol that hangs from my rearview mirror, smell whatever vent I have. I mean, I've got it all set up. Smell, I can grab gum if I need to, and I just go to all my senses. So I'm no longer ducking down in the car. I'm just refocusing because that
Good
ambulance
for
isn't
you.
coming to get me. The helicopter, I might look at it, but I now know enough in my brain to say, okay, if I need to just like rub over my eyebrow, which is touch, I'm
Yeah,
taking
yeah.
my attention off. I might tap my fingers together in a series of four. I know the grounding techniques to what's it, deflect, to whatever I need to do to move my mind from that
Yeah.
into the present
Diffuse the
moment that can't hurt
situation
me.
too.
Yep.
Well, and it's
So
interesting, just things in everyday life that could actually help, whether it's PTSD or other kinds of things. I know I had a podcast episode maybe a couple months ago now, where I interviewed someone who works with horses and ways that horses can actually help people with autism, people with
yeah.
PTSD. I mean, all kinds of different things. And I before I would have thought, oh, well, you just ride a horse to have fun. Well, it's true, it is fun. But there's something about actually sitting on the horse. It's the vibration that goes up to your brain, from the cadence of being on the horse.
Mm-hmm.
So yeah, that kind of stuff can help as well. And then I also know that like VA hospitals, it's common for them to have dogs for people who are
Oh,
having some kind of a
dogs.
traumatic stress reaction to
Yeah.
get to actually lower stress hormones and increase
Mm-hmm.
dopamine levels, an actual feel
Mm-hmm.
good chemical. So that's
Yeah.
interesting.
I took up art as well. And I'd
Mhm.
always painted, and this time I took up acrylic painting. But when this all started, I did just some abstract, which I don't love abstract art, but I tend to paint in abstract art. So weird. And I look back at this first painting I did early on, and it was very black and white and gray. And I didn't even think about it. I just laid out my colors, and that's what I painted. And then, months later, I went back to do another one, and it was yellows and reds and whites. And I looked back at the first one and looked at this one unprovoked and was like, wow, like it just told me so much about this is it was like the brain trying to communicate and speak. And there it was on paper, on a piece of canvas, and the
Yep.
difference, the perspective of the difference, and where I ended up.
Oh
And
yeah.
yeah, and some of the stuff with aortic hope, think I said this to you, I have to coin the phrase that a lot of it is selfishness turned into selflessness, and I know that can come across as negative, but let me say why. The other initiatives that we moved on with, Survivor Series, I wanted to tell my story. I wanted to get it out, selfishness, and I did, and then everybody else started telling it, and I was like, wow, they are feeling good too. Who would have thought that? And I'm feeling good listening to them. Support groups. I needed support. There were none. I created it. Now I'm giving support and I'm getting support. And now this is amazing. And they're feeling it too. The Hope Mail. I wanted presents. So when we pick out our items to give, I pick out things that I would really like to. It's the same thing. And
Yeah.
it just tends to be everything. And our most recent initiative is Aortic Dissection, the Patient Guide, which long story with that, but basically we took this already produced product from our friends, the Aortic Dissection Awareness UK Ireland, and we brought it to the States and we completely edited it. And now we have it available to give to patients. is exactly what I would have begged for after my dissection. It's
That's
so
cool.
easy to read by patients for patients with the assistance, of course, of clinicians and consultants.
Right.
It is my dream. It is everything I spend 365 days a year presenting to the community. It's everything we do as an organization in this guide for the dissection community. And that's why I say it's like selfishness into selflessness, because it's everything we want because we need, and we listen to other people's needs, and then we're able to give it back and make it come into a reality.
Well, it's interesting too how you could take a book that people initially had written in Europe, and it applies to. I mean, people are people regardless of where you're
Hmm.
from. And
Yeah.
an aortic dissection is the same thing regardless of who you are, or where you're from, depending on if it's the, like, to your point, the upper or lower or what have you.
Right.
But for your aortic hope sessions, like the actual, like you mentioned, being on Facebook and the whole live aspect and different things, how did you initially attract people from other countries? Because I understand it's people from
I know.
India, it's Europe, it's
Oh
Canada,
gosh.
it's all over the place.
Yeah, and that's a hardship. I mean, it's wonderful and it's also hard depending on the country. Any countries, most countries in Africa, if you think you're having an aortic dissection, the best I can do is just wish people luck, because the amount of
Wow.
time it's going to take them to get to a facility that may or may not have a CT or MRI, that may or may not then have to move somebody onward for surgery, is gut wrenching
Yeah,
to me.
yeah.
Same problems in India, same problems I was just looking in the Philippines, I think, that even when they are diagnosed, there just might be one doctor and then you're waiting for someone's schedule. So it's very easy for us here, the UK, Ireland, Canada, Australia, to be able to say, oh yeah, we'll just go get a CT scan, we find a great doctor and get surgery. There's too many countries where it's not a reality
Right.
for any of them. So our books they're just not really applicable. If anything, it's just dangling a carrot that they're not going to necessarily see come to fruition. But I think what happened for us is we just started blasting that we were doing things, and we were having these interviews across the two more common Facebook pages, Survivors of Aortic Dissection and Aortic Dissection Survivors. But then we started branching out and we changed the Dissection Awareness Day into Aortic Disease Awareness Month, pulling in the bicuspid valves, pulling in the stenosis, pulling in the
Okay.
aneurysm patients, top to bottom, thoracic, abdominal, it's anything. And once you make it anything, then there's even more people that want to come into your community.
Oh yeah, I could see that. Well, I
Yeah.
also appreciate the fact that you, of course, acknowledge patients and then survivors like yourself, but also caregivers. A lot of
Hmm.
people don't have the presence of mind to think about caregiving,
Right.
but that's a big deal. And caregivers aren't always simply parents taking care of kids. It could be
Hmm.
kids taking care of their parents. It could be someone taking care of their parents and their kids. It could be
Right.
one sibling taking care of another, one spouse taking care of another. I mean, it's a lot to get your head around. And so I'm happy that there's a sense of community for those people as well, through the things
Oh,
that you have to offer.
yeah, because our emotional reactions to this, our PTS to this is different. And trust me, they have their own post-traumatic stress from our experience. And, my my parents were planning my funeral. They were just thinking, who are we going to call? And that is just so tough. uh, my husband felt like no, she's going to survive. It's not going to be today. And that's tough. And to the point that if he calls me, I mean, anybody that knows me, if he calls, I stop what I'm doing. I texted him before this. I said, I am home and I'm jumping into a podcast. I will call you when I'm done. Because if he
Uh,
calls and I don't answer, there have been too many times where I have become overwhelmed or had a mini stroke or a complex migraine, and then I'm like, I don't know where I am, or I've had to call him before. So they get triggered. And
uh,
to that also, my aortiversary is in January. Year one, we had dinner. I wanted presents because it's a rebirth day. I'm like, oh, I want presents. Year two, they didn't even want to go. They're like, please don't make
oh,
us go. We think about this
wow.
every day. So your two
Uh,
came and went with just friends. So I said, fine, family every 5 years. So
yeah.
5 years will be in 2025. But
Cool.
yeah, caregivers, there's this whole world of, yes, we sit with guilt. We've changed their world. We've changed everything financially, physically. There's sexual dysfunction, erectile dysfunction. There's so many things that happen to us as patients. But the caregivers, they do not ever want to openly admit that there is resentment, which is normal. I'm not upset if someone resents that their life has changed,
Right.
but if you're a new survivor, it's going to be soul crushing. and they have their own guilt. They have a
Oh, yeah.
plethora of emotions, and
Yeah.
they need to be able to express it freely without us around, us survivors.
Oh, absolutely.
Yeah.
So, what are some resources that you could point some of the listeners to? I mean, obviously, your organization, but what is your website, and what are
Yeah.
different things they could reach out for?
Sure, aortichope.org. And also we have our YouTube channel, AHTV, so you can go into our YouTube channel where I go live every Monday, another person of the board will go live, kind of just to capture those people that might not be on Facebook to discuss all the educational posts that we provide to the community. They also can we're on Instagram, we're on LinkedIn, we're on Twitter. I'm threading every now and then. I think that's I'm too old for this. My
I,
next step I'm going to try to TikTok something. I don't know. But
I
obviously the
know.
website, Facebook. Yeah, at
Yeah.
Facebook, our Facebook main page, Aortic Hope, is where you're going to find all of the information and events. Private forum, chit chat away, caregivers chit chat away. Again, you can sign up for our support group meetings, the book, Aortic Dissection, the patient guide. And then there's so much resources for your physicians as well between the patient guide and awareness posters. But obviously, if you know you have Marfan syndrome, Lowy Dietz, or vascular Ehlers-Danlos, they have their own communities as well that will specialize to your very specific medical needs.
Okay. Okay. So, is there anything that I haven't called out today that you want to call out for listeners?
Oh gosh. You know what? There's so many different emotions that people feel from self-consciousness with scars. We
Mm,
really need to take away the stigma of scars. And I'll tell you what, with any issue, illness, we need to take away the stigma of having a disability or a less ability. It's
mm,
just, I don't look at myself as having a disability. I never did. I never liked those words. I'm differently abled. That's just what it
yeah.
is. And I'm right.
Yeah.
Okay. And I'm not negating whatever the politically correct term is because things change, and I mean this with all respect. I don't know if
Yeah.
it's disabled. I don't know. I don't think they use handicapped. I'm not sure what it is. I'm just differently abled. So although
Nice.
I'm not climbing Mount Everest, I'm walking flat, and I'm walking flat pretty good. I can really master Disney because that's pretty motivational to me. But there's things I do that's different. I'll tell you what I do that's very different. I spend a lot of time just enjoying life and pausing. The days of me working to earn money for someone else or so that I can take a vacation are long gone. I have recognized how short life is. I know people say that's just such a saying, but it is short for
It is
all of
short.
us, even those that don't have an issue. You need to stop and smell the roses, as they say. Take a minute because it's going to go by really fast. And we're
I
not
agree.
getting out of this life unscathed. We're all going to end up at a finish line. Enjoy the road to the finish line. Don't just survive, strive to thrive. It's what we need to do.
I like
What we
that.
need
That's
to
a
do.
great way to close out the episode today. So thank you very much. Very, very well said. But thank you so much for doing the interview today. I appreciate it, not just on my behalf, but also for anybody who's going to be listening. So thank you very much. Also, for those of you who are listening, thank you very kindly for doing so. Again, my actual channel on YouTube is Emotional Grit. Feel free to watch the episode there and others as well. Thanks, everyone.